Hello, my name is Odile Ulner and I'm from Deutsch for Docs. We prepare foreign doctors for the medical language examination that is necessary if you want to pass the exam, the FSP exam, and if you want to get a work permit and afterwards work in a German hospital. Today I would like to introduce you Dr. Igboerika from Nigeria. He was one of our best participants in our courses last year, and he can tell you how he could manage to pass successfully the exam and also how he could manage to find the job here in the clinic in Hann Muenden where he works. Thank you.
Yeah, good day. My name is Dr Igboerika. I'm happy to be part of this program. I would say it was difficult in the beginning, but with the help of Deutsch for Docs, I was able to scale through. I was able to pass the exams needed to obtain the medical license here in Germany. The process is actually a very long process. You have to just be patient and persistent with what you want. First of all, to practice in Germany, you have to learn the language. I was able to do that in Göttingen. First of all, up to the level of B2 level, according to the European language framework. And then the next step was to pass the so-called Fachsprachprüfung. That is simply put a medical language exam to test your ability to communicate in German language with the colleagues, the doctors, and also with the patients. In order to pass this exam, it is very necessary that you enroll in a preparatory course, for example, as offered by the Deutsch for Docs, and then because you could try to do it alone, but it's a lot more difficult to achieve that alone. The Deutsch for Docs will provide some guidance. They have well-experienced teachers who will guide you with the rubrics of the examination, and then they were very, very, very much hardworking. They were always available to correct your medical reports, which is also an important part of the examination. They were always around to correct your grammatical errors, to encourage you, most importantly, never to give up. The course lasted about 12 weeks, and the first stage was basically introductory phase, where you learn the basic rubrics of history taking, how you discuss with the patients, the examination, and lastly the medical reports. Towards the end, and where we engaged a lot with simulated patients who were always available for you to practice your history taking and then present the cases, because that's exactly what the exam is all about. You have to take a history, you have to examine the patients, and even if you don't examine in some states, you have to explain the examination process, and then you also have to document your findings in the form of a medical report, or just a little later. It's not so complicated, and yeah, that's basically what it takes. But with such programs like Deutsch for Docs, of course, there are a lot of programs here in Germany that offer such programs. But I would say Deutsch for Docs, yeah, is one of the best, and I will always recommend that for anybody that wants to come over to Germany. Thank you.
Thank you very much. And you are working here in which field? In the field of surgery, or what are you doing here? Perhaps can you tell some words about your work?
Yeah.
Just a few words. Mm-hmm.
I'm currently doing my residency training in internal medicine here in Hann Muenden. It's a middle-sized hospital, I would say, with about 200 beds. And a lot of renovations are also going on. A lot of new wards are being opened up, and the hospital is very famous for it's a large kidney center with a lot of transplantation, and if you want to gain a wide knowledge of medicine, it's a good place to work. There's always the confusion of working either in a very small hospital in Germany or in a big hospital, for example, in a university hospitals, the teaching hospitals. But there are advantages and disadvantages of the two institutions. But at the end, for a start, it's always advisable to start with not too big hospitals so that you get accustomed with the system, and then you have the opportunity of having a wider knowledge basis. And that was the reason I chose here, and I would say I'm comfortable up to this moment working here, and it's okay. It's quite a familiar environment, and you can easily reach your superiors. The consultants are always available to hear directly from you. There is no long bureaucracy. You get to know your colleagues very well, the nurses, the doctors, and all the staff here. That's one of the reasons I enjoy working here, and communication is not complicated. People understand your peculiarities here. That's the reason I'm here. Thank you.
Thank you very much, Dr. Igboerika. I think now foreign doctors, they can have a good impression about you, about your work here in the Klinikum Hann Muenden, and thank you to the hospital in Hann Muenden that they allowed us to make the interview with you. We wish you good luck, and good luck for you and your family, and all the best for you. Thank you again.